I'm Dr. Josh Cooper,
And I'm Dr. Scott Sattler.
and we are Sound Plastic Surgery located in Seattle, Washington, right next to University Village. I always go over with my patients our number one, infection, which is always a possibility. Actually pretty rare. We give our patients IV antibiotics at the time of the operation. So I haven't found infection to occur very frequently. Bleeding is always something we have to discuss. I'd say in about 4% of patients, or maybe even a little bit less, hematoma does occur. Hematoma is a large collection of blood that occurs after the operation, and if that happens, we actually have to take patients back to the operating room and evacuate that hematoma. So that's something we always need to discuss.
Yeah.
Delayed healing is another potential complication. That incision that's very low down in the bikini area, occasionally a very small area can open up, maybe the size of a pencil eraser or smaller. If that happens, we apply antibiotic ointment and a Band-Aid for a few days up to a week, and usually with time that heals on its own. We call that a minor complication because it almost never requires a trip back to the procedure room or to the operating room.
Yeah.
Other risks would be hypertrophic scar formation, where instead of ending up with a nice thin scar at about 6 months to a year, occasionally patients can end up with a real thickened and raised scar. That's called a hypertrophic scar. Again, it's really quite uncommon in my experience. If that happens, we can always inject a steroid into that scar to help with that.
Yeah. I'd say the other risks to discuss would be scar widening. There's a lot of tension on the wound closure, and if it's not properly closed with multiple layers that are kind of offsetting the tension that's directly on the skin, then the scar could widen. I haven't found scar widening to be a big issue with tummy tuck surgery. There's so many layers to use to offload that tension on the skin that in general the scar quality is quite good. The other two risks to discuss would be seroma, which is a fluid collection beneath the abdominal flap and on top of the muscle plane. Seromas are quite rare with tummy tucks, but they do occasionally occur. I think they're in part prevented by the use of surgical drains, which we remove 5 to 7 days after surgery. I also think that some nuances in dissecting the abdominal flap, leaving some lymphatic tissue on the lower abdominal fascia, help prevent seroma as well. We've found that at least in our review of the medical literature, that the use of low-dose Lovenox substantially reduces the risk of DVTs in patients that undergo a major surgical procedure under a general anesthetic. And we've kind of brought this idea into our own practice, and it's, I think, in some ways become the standard of care, at least in our surgical community. A DVT in of itself isn't necessarily dangerous, but when that DVT migrates and goes up to the lung and becomes a pulmonary embolism, that can put patients' health at substantial risk, could even cause death in the worst case scenario. So we feel that using low-dose Lovenox for 7 days after surgery is an important safety adjunct. We do teach the patients to use the medication. It is an injectable medication, but it's just like administering an insulin shot to oneself. I think when we go through our photo galleries, the ones on our website or the ones that we share with patients, the most dramatic transformations are the tummy tuck galleries, where we can take a patient with substantial amount of excess skin, a rounded, kind of aged-looking abdominal contour, and create a nice flattened, youthful-looking abdomen. And there's just no other procedure that can deliver that type of result besides a tummy tuck.
Yep. Agreed.
Yeah.